Good morning to all. Thank you, organizers, for this wonderful opportunity. So I'm going to review an abstract from Japan. It's basically a phase 1 study. It is labeled as a phase 1 study of Afatinib in combination with Osimertinib in patients after failure of prior Osimertinib. So coming to the background of the study, with the first line use of Osimertinib, the PFS and overall survival definitely improved, but unfortunately resistance is a norm and most of the patients will develop secondary EGFR mutations, other uncommon mutations, and ultimately have a progressive disease. And coming to the tackling of this uncommon mutation, tackling of the secondary EGFR mutations, I think the largest prospective study which we have is the combined post-hoc analysis of Lux-Lung study, which basically had the EGFR TKI Afatinib in patients having the uncommon EGFR mutations. And there are several preclinical studies as well that suggested that concurrent use of Afatinib with the Osimertinib may have the potential to eradicate these secondary resistant clones and also to existing uncommon EGFR mutation clones. So with that, the hypothesis in the background, the investigators have designed this open-label phase 1 study that enrolled patients who had experienced progressive disease after prior use of Osimertinib. And this is basically a 3+3 dose escalation study enrolling patients in 3 different dose levels of Afatinib, obviously in combination with Osimertinib at a standard dose of 80 mg once daily. And the 3 dose levels are level 1 20 mg, level 2 30 mg, and level 3 40 mg. And primary endpoint of the study is the maximum tolerable dose. And secondary endpoint are overall response rates and survival outcomes. So this is not a very large study. It included around 13 patients, out of which 1 patient had experienced a early disease progression, so excluded from the analysis. There are 6 patients in each dose level, level 1 and level 2. And at level 1, 1 patient experienced a grade 3 diarrhea, which is the dose-limiting toxicity. And level 2, 2 patients experienced grade 3 diarrhea and intolerable grade 2 nausea, which are again dose-limiting toxicities. So investigators have decided that the maximum tolerable dose for Afatinib in combination with Osimertinib at 80 mg is 30 mg of Afatinib. And the common or frequent adverse effects are the GI toxicities of diarrhea and nausea, 76%, anemia 76%, and rash at 70%. And considering the toxicity profile, investigators have recommended that the recommended dose of Afatinib will be 20 mg once daily in combination with Osimertinib 80 mg. And among the available patients, which are 12, the overall response rate is not very high, it's 1.7%, but disease control rate is around 46%. And the median PFS again is dismal at 2.4 months, and making the conclusions that there is probably not much of an additional effect of Afatinib on Osimertinib in the Osimertinib resistant setting. And again, I would concur with the author's conclusions. Probably Osimertinib is such a effective drug, and the mutations that happen over Osimertinib probably cannot be tackled by another TKI alone. And combination therapy in first-line setting is appearing promising. And by this data, the combination therapy appears to be tolerable and safe. That would conclude my talk. Thank you very much.
Thank you, sir.